What is up, everybody? Dr. Shadi Rafich here. We're going to talk about anxiety, separation anxiety in dogs, actually. It seems to be, and maybe this is similar to those parents out there who have kids, that as this COVID pandemic and self quarantining is becoming less upheld, and there's more freedom, that people are going to start going to work and going out living their lives, and our pets, our dogs, have been used to us being around them 24/7 for months now. And so separation anxiety might be an issue for them. So let's talk about it. Let's talk about what separation anxiety is, what does it look like, how to diagnose, and then of course what can you do about it. So separation anxiety is, of course, as most behavioral diseases in dogs, quite complex. It's a diagnosis based on the observations or the descriptions of the pet owner, you, the pet owner, as you give the information to the veterinarian. There's no blood work for this, there's no x-rays, there's no obvious clinical diagnostics we can perform to diagnose the condition. It's simply based on what is your dog doing, and do the behaviors meet the criteria for separation anxiety. And so with that comes some level of ambiguity, right? So you have to know your dog, first of all. Some dogs are just naturally hyperactive, some are just naturally kind of subdued and chill, everything in between. We all know that dogs have different personality types. We also know that different breeds have with them, for the most part, personality types associated with those breeds. And with that, you have to take into account the individual dog's personality. So some pets just act crazy, and that's how they are, and some are more calm. Separation anxiety is a condition whereby the pet exhibits usually either hyperactive behavior, panting, pacing, drooling, destroying furniture, self-mutilation by excessive grooming, things like that, or they're showing excessive lethargy. They're more subdued. They're lethargic. They're just not interested in the environment. They act like zombies when you're not around. And of course, we're more familiar with the former, with the more hyperactive dog as being the classic anxiety or anxious dog. So we have to, of course, separate this discussion from anything relating to behavior changes from pathologic conditions or disease. There are diseases that can affect the behavior of dogs, either neurologic disease or hormonal disease or whatever it is. We're specifically talking about those dogs that have been deemed by a veterinarian to have signs consistent with separation anxiety. So there are, of course, studies, and one in particular in the Animals Journal 2019 that did look at hormonal levels in association with separation anxiety in dogs. In fact, there are a few studies that looked at how to associate blood work abnormalities with the behavior itself. And that way maybe we can get more of a objective method to diagnose these dogs, other than questioning you, the pet owner, and going based on the veterinarian's experience and what have you. It still may be, or still going to be at present time, a diagnosis of exclusion, meaning you rule out diseases that could be causing these abnormal behaviors, and then say, okay, well, since all these tests are negative for whatever disease I was looking for, clearly you're dealing with a dog that has separation anxiety. Okay, so now we have the diagnosis, we know what these dogs act like, and so what do you do about it, especially during coronavirus? We had a dog prior to the lockdown that was a normal dog, didn't really go haywire every time you left the house. Now that you're leaving the house, more and more the dog is becoming more and more anxious. So there's really two methods that you could consider when trying to manage dogs' behavior issues in general, but especially with separation anxiety. One, of course, is training, right? You can either do your own training at home, you can see a individual in your area who's very good at dog training, or you can see a board certified veterinary behaviorist, all of which are fair enough. And something as simple as just gradually spending more and more time away from your home week by week to get the dog used to you not being home. From seeing a professional behaviorist, a veterinarian who specializes in this, and having long sessions day after day, week after week, trying to figure out how to troubleshoot this problem. And behavior modification is, of course, fantastic. It allows you to not use any medications. It does take a lot more work and time to invest in the dog, but these are methods that you can do either at home on your own, or you can get a dog trainer or schedule a consultation with a veterinary behaviorist. The second category, of course, is pharmaceutical intervention, right? Medications. Prozac is a common one, and we use Prozac a lot. Really, regardless of their behavioral issue, if we deem it that they don't have actual disease, they have a behavioral problem, and it falls under the category of separation anxiety or being fearful or being aggressive or whatever it is, then Prozac is the staple medication that veterinarians will go through. Obviously, of course, I'm going to stress the importance of following your vet's recommendations as to whether or not they want to use medications and which one they want to use. There are other different modalities. You can use various other pharmaceuticals. You can go with diet changes, more herbal supplements, acupuncture. All these things are viable, and so you're going to follow your veterinarian's recommendation with regard to what to do. But Prozac is the most common example of a pharmaceutical that's been used fairly successfully. Again, seek out your veterinarian, make sure you have a complete physical examination, some baseline blood work, and your veterinarian may actually pursue further blood work down the line. So how does a medication like Prozac work? Well, fluoxetine is the medical name for it, and it's considered a selective serotonin reuptake inhibitor. So what it does is it prevents serotonin, which is a very important neurotransmitter. It's a hormone or a chemical in your body that affects your brain, and it prevents it from being taken up by the nerves after it's released and being broken down or recycled. So if you prevent its uptake to the nerves, that's the reuptake inhibitor portion, then it's going to be in the cellular space, circulation, or whatever for a longer period of time, and it'll exert its effects for a longer period of time, modifying the behavior towards what you want, a more kind of a cool, chill dog that's not so anxious. And that's serotonin is the hormone we're talking about. There are other functions of Prozac as well that we won't go into, but there are also other medications that can modify behavior as well, different modalities. But the SSRI, the selective serotonin reuptake inhibitor medications, are probably the most common that we use. But again, always seek the recommendation of your veterinarian or veterinary behaviorist prior to deciding to put your pet on pharmaceuticals for this problem. And so with that, I hope this video enlightens you a little bit more on what it means to have a anxious dog, how it relates to our current time frame now with this whole COVID lockdown, pandemic, self-quarantine, all that stuff. And yeah, if you are more inclined to kind of try more natural ways of doing this by behavior modification at home, then I would suggest slowly increasing the amount of time you spend away from home and let your dog get used to that. If you tried that and it's not working, then maybe you need the expertise of a dog trainer or a veterinary behaviorist. Otherwise, if you just don't have the time or skill set to look into this further and spend time teaching your pet how to get used to you not being at home so much, then we can have a visit with your veterinarian and make sure that Prozac is something, or a similar drug is right for your dog. Thank you so much, Dr. Shadia Rafij. Please check out my YouTube channel as well. I do have other videos on there on a scope of veterinary topics, especially I did make a recent one on behavior in dogs, and so how veterinarians think about it. So feel free to check that out, and I'll see you in the next video. Take care.